Welcome back. Now, tomorrow MPs will debate the President's State of the Nation address. NHI will undoubtedly receive attention. During the SONA, President Ramaphosa reaffirmed his commitment to the healthcare access plan, but made no mention of what it may mean for private medical aid schemes. This despite reports that the provision in the Act that would see all medical schemes collapse into a single fund to accommodate the plan has been removed from the draft medium-term development plan. And while the pursuit is on for universal health coverage, U.S. President Donald Trump's executive order cutting aid to South Africa may impact the fight against HIV/AIDS. Alex van den Heever, healthcare governance expert from the Wits School of Governance, joins us to weigh in. Alex, thanks so much for your time. As mentioned, there have been so many reports around the Act in connection to the provision around medical aid schemes. Let's start there. How important is it for us to just get the clarity, you and I, the everyday person, around this?
Well, I think it is important to get clarity. I mean, I think the key issue that has been raised by many people is the technical unfeasibility of the proposal in and of itself. So it's not really implementable, and it's most certainly not implementable in the medium term. So the concern really is that government is kind of chasing its tail, chasing a policy that it can't really implement, but is kind of trying to scare the industry and the health system with massive changes that it can't cope with, and creating uncertainty, and people do deserve to have certainty. There is no possible way that medical schemes can be eliminated or absorbed into a national health insurance fund. It's not feasible, and that's probably why there was discussions about taking it out of the medium-term framework, because you couldn't make a promise to do anything in the medium-term framework along these lines.
So, you know, we talk about the NHI being highly contested. We're seeing it within the GNU, where we're seeing the DA and the ANC not agreeing to certain terms of the Act and how they would like to see it implemented. Are we likely going to perhaps see some adaptations or further back and forth before we really get on the path of universal free healthcare?
Well, we should have universal healthcare in South Africa. It's never going to be free. Somebody's going to always pay.
Okay.
The main issue is making sure you don't pay when you use the service, and that doesn't become a barrier to access. So people on medical schemes pay for their healthcare through contributions, but they're then facing a reduced financial constraint in accessing the actual service. A large part of the population actually gets free healthcare. In other words, they don't pay anything, but somebody else is paying, the taxpayer is paying. And the system is therefore designed along these lines. There's no other real model for South Africa. So we're in that mode. We already do this. The problem is really that there are major gaps in the framework. Now, the president has proposed that some sort of council will be established to take forward some of the ideas in the NHI framework. I don't know what that would mean and what they would actually focus on. But the question is really that a lot of people are concerned about is that there are a huge number of reforms that are needed in the health system, and they aren't in the NHI Act, and they're not these proposals. They're about addressing systematic corruption in the public sector, governance reforms in that side that basically make sure that the rand actually hits the service, which it doesn't do at this point. And on the private sector side, the Health Market Inquiry made extensive recommendations. They had a committee. They sat for 5 years. We don't need another council on diagnosing and making recommendations. There's a question as to what should be done. The problems are well known, well understood, and have been documented in detail. The government basically has not done anything. And so the danger is that these discussions about NHI just become a distraction from actually addressing real issues, because there's a pretense that reform is happening when it's not. And so I think a major concern is that basically NHI is an excuse for the status quo. It keeps all the players in play that are currently milking the system. And there needs to be reform, and there needs to be a focus on stuff, on reforms that can address those issues, not distractions. And I think that's where I think we're going to see conversations this year, very heated conversations, not necessarily within the government of national unity, but within the health system. Government basically can't be permitted to sit on its hands anymore.
And you mentioned reforms, and while we try and reform the system, another issue coming through, Trump recently withdrawing US aid to South Africa, funds used to fight HIV/AIDS in the country. Talk to me about the significance of losing this funding, especially as we look to implement the NHI.
Well, its implications for NHI, I think, is inconsequential because there's no NHI. The question is, what's the impact on our health system? Because there was quite a lot of financial support provided, particularly for systems around the antiretroviral program, and a fair amount of resources that were committed for that program. I think that the US is in a state of confusion at this stage. Some of the smoke might clear. But this was actually an initiative that was, that was started by the US. It wasn't that South Africa went to the US and said, create PEPFAR. It was a George Bush initiative. And so I think that it was one that had a lot of support from both the Democrats and the Republicans. And I think what we've got is a group of people in the White House at the moment who have no institutional memory for anything that government has been doing in the US. And in some respects, some of that institutional memory might actually catch up with the White House in the next couple of months. So I think there's going to be a lot of uncertainty. But as it stands now, the programs are at a standstill, and government can afford to cover the antiretrovirals. And on the medical scheme side, these are covered. The question is the additional support, the management and the systems and so on, which were being funded, are now uncertain. And there's a lot of research programs that are underway in South Africa that are essentially very important. And again, those are in a state of uncertainty until the White House catches up with its own institutional memory.
All right, Alex, thanks so much for your time and just sharing those insights with us. That was Alex van der Heever, healthcare governance expert from the Wits School of Governance.